The spoonful of hot chicken soup was halfway to my mouth when I felt it. The familiar, unwelcome trickle. Not from my eyes, but from the very tip of my nose. I wasn't sick. There was no congestion, no headache, no telltale ache in my bones. Just a clear, watery drip that threatened to land in my bowl, a quiet betrayal by my own body during a simple, comforting meal. It was a minor nuisance, a small mystery repeated with steaming mugs of tea, brisk winter walks, and even moments of sharp concentration. This wasn't illness. This was something else, a glitch in a system I had always taken for granted, prompting a question I'd never before considered. What exactly is a nose for? We reduce it to smell and an airway, but its true design is a masterpiece of silent, constant engineering. Every breath we draw is an invasion of potential chaos. Dry air, dust, pollen, microbes, temperature extremes. The nose is the vigilant gatekeeper, transforming that chaos into a safe, conditioned stream for the delicate lungs. Its interior is a cavern of intricate architecture, lined with mucous membranes rich with blood vessels and dotted with microscopic, hair-like cilia. Here, in the perpetual twilight behind our nostrils, a hidden river flows. Specialized glands produce a precise quart of clear, thin fluid every day, a volume that staggers the imagination when considered over a lifetime. This river is never still. It sweeps forward in a constant, coordinated wave, propelled by the beating of those countless cilia. Inhaled particles stick to its moist surface, are trapped, and are marched silently backward down the throat to be neutralized by stomach acid, a process so efficient we are blissfully unaware of the daily particulate armada we swallow. Simultaneously, the nasal turbinates, those bony, scroll-like structures, swell and recede to warm and humidify the incoming air. Icy winter breath is heated to body temperature and saturated with moisture before it ever touches the throat. This is the nose's true, unseen work, a filtration plant, a humidifier, and a climate control system operating on a flawless, automated loop. The balance is perfect, the drainage discreet. The fluid produced is meticulously matched by the drainage capacity, all of it channeled rearward, an internal process meant to be invisible. So what breaks the seal? Why does this elegant, backward-flowing system sometimes fail, allowing a portion of its output to escape forward, beating at the nostrils in a clear, embarrassing declaration of hydraulic overload? The mystery deepens with age. The drip seems more frequent now, more insistent, triggered not by pathogens but by the benign, heat, cold, a spicy bite, a focused thought. The machinery is the same, but the regulation is off. The thermostat is flickering. This subtle malfunction points not to a broken part, but to a confused command center. The answer lies not in infection, but in a misfiring of signals, a condition with a deceptively clinical name that holds the key to the mystery: non-allergic rhinitis. The diagnosis of non-allergic rhinitis, I learned, is less about identifying a foreign invader and more about understanding a communications breakdown. It is the story of crossed wires and amplified signals within the body's own nervous system. At its heart lies the autonomic nervous system, the silent, subconscious network that manages everything from heart rate to digestion, including the precise calibration of nasal fluid. This system has two main branches: the sympathetic, which prepares for action and typically dries secretions, and the parasympathetic, which governs rest and, crucially, stimulates glandular output. In a youthful, well-tuned body, these branches work in harmonious opposition, a delicate dance ensuring the nasal river flows at just the right rate for the current conditions. With age, the dance can become clumsy, the signals less precise. The trigger is often a simple, physical stimulus that the nerves misinterpret as a call to arms. I experienced this firsthand one brittle January morning. Stepping from the humid warmth of my kitchen into the knife-edge cold of the outdoors, the shock was instantaneous. The frigid air hit my nasal passages not as a temperature to be moderated, but as a profound irritant. My confused autonomic nerves, their signaling pathways perhaps worn a bit thin, sounded a false alarm. Interpreting the cold as a threat, they triggered a parasympathetic overreaction, commanding the nasal glands to flush the perceived irritant away. The result was not the slow, efficient humidification of my breath, but a sudden, copious surge of clear fluid, a desperate hydraulic attempt to wash out an enemy that was only winter itself. The same principle applies to gustatory rhinitis, the runny nose triggered by food, especially hot or spicy meals. The soup that started my inquiry was a perfect example. The capsaicin in pepper or the simple thermal heat of the broth stimulates sensory nerves in the mouth and palate. In a younger system, these signals are neatly contained, but with time, the neural boundaries blur. The hot signal from the taste buds can spill over, inadvertently activating the nearby nasal gland nerves. The brain receives a jumbled message. "We are under spicy attack." The response is the same glandular surge, a physiological non sequitur where enjoying a meal necessitates a stack of napkins. Even stress or intense concentration can trip these wires, as mental focus subtly alters autonomic balance, tipping the scales toward secretion. This tendency worsens after 60 due to a confluence of subtle anatomical changes. The nasal tissues themselves undergo a gradual thinning and drying, becoming less resilient and more irritable. More importantly, the autonomic nervous system grows increasingly sensitive and labile, its feedback loops less dampened. It becomes a hair-trigger device, prone to overreacting to stimuli it once managed with ease. The system isn't broken. It's become a hypersensitive instrument, playing too loudly at the slightest touch. Understanding this was profoundly reassuring. The clear, symptomless drip was not a sign of illness or decay, but a regulatory hiccup. It was my body's climate control system momentarily mistaking a cool breeze for a sandstorm or a flavorful meal for a chemical assault. The fluid itself was the same benign, protective secretion as always, just produced in a sudden, uncoordinated excess that overwhelmed the rearward drainage. The nose was doing its job, but the management had issued a panicked, overblown order. This realization reframed the entire experience. My runny nose was no longer a petty annoyance to be resented, but a tiny, visible window into the aging nervous system, a system growing wiser in some ways, yet more temperamental in others. It spoke of a lifetime of signals sent and received, of pathways now so well-trodden they sometimes short-circuit. Managing it, I saw, would not involve fighting a disease, but gently coaxing an overzealous system. It meant anticipating the triggers, the step into cold air, the first spicy bite, and understanding their neural echo. It was a lesson in listening to the quiet misfires of an aging body, not with frustration, but with a curious empathy, recognizing the drip as a message from the tangled, faithful wires within.